The birth of baby can trigger a jumble of powerful emotions from excitement and joy to fear and anxiety. But it can also result in something you might not expect, and that's depression. In today's video, I'm going to talk about post-pregnancy depression, what it's like, what are the causes, risks, and complications, and also how you can treat it. So keep watching. Hey guys, this is your pharmacist Sidra, and welcome to my channel Ask Your Pharmacist, which is all about health and pharmacy. So today's topic is super important for all the new moms and people around them because often people don't consider postpartum depression as a real problem, which is a problem. Now, it's not just in the head of the mom, it is actually a condition which she's going through and it should be taken seriously. See, your body and mind goes through so many changes during and after pregnancy. If you feel empty, emotionless, or sad almost all the time for longer than 2 weeks during or after pregnancy, then reach out for help. If you feel like you don't love or care for your baby, you might have postpartum depression. Now, postpartum depression is sometimes confused with baby blues, in which women feel saddened or empty within a few days of giving birth. For many women, the baby blues go away in about 3 to 5 days. However, if baby blues don't go away or you feel sad, hopeless, or empty for longer than 2 weeks, you may have postpartum depression. Postpartum depression is a serious mental illness that involves the brain and affects your behavior and physical health. It may interfere with your day-to-day life, may make you feel unconnected to your baby, so be watchful of it. See, you may have no energy or motivation, thoughts about hurting yourself or baby, or you may be crying a lot. Also, you may withdraw yourself from friends and family, may have trouble focusing, you may lack sleep or find yourself sleeping a lot. It's not you being overwhelmed because of newborn. These are legit symptoms of a serious health condition which you should not ignore or be embarrassed about. I've seen a lot of mothers being ashamed or guilty of being depressed when they're supposed to be happy after having a baby because they worry that people will see it as a bad thing or people will call them bad mothers. See, this is the stereotype that we need to overcome. Just remember, any woman can become depressed during pregnancy or after having a baby. It doesn't mean you're a bad mom. See, you and your baby don't have to suffer. There is help. Your doctor can help you figure out whether your symptoms are caused by depression or something else. So, what causes postpartum depression? See, during and after pregnancy, a woman is actually going through a roller coaster of emotions because of the hormones. When you're pregnant, the levels of female hormones estrogen and progesterone are highest they could ever be. And within 24 hours after the childbirth, the levels actually shoot down back to the pre-pregnancy levels. The researchers think that this sudden change in hormone levels may actually lead to depression. This is similar to hormonal changes before a woman's period, but involves a much more extreme swings in hormone levels. Your thyroid hormone may also drop sharply after giving birth and may make you feel tired, sluggish, and depressed. And in addition to that, you may be going through mixed feelings like you may have become self-conscious, you're probably feeling less attractive or stressed about being a perfect mom, you may be having lack of sleep, and all of this can contribute to postpartum depression. Let's talk about some of the risk factors associated with postpartum depression. See, any new mom can experience postpartum depression and it can develop after the birth of any child, not just the first one. However, your risk increases if you have a history of depression either during or after pregnancy, or you have bipolar disorder, you had postpartum depression after previous pregnancy, you have family members who had depression or other mood disorders, or it could be that you've experienced stressful events during the past year, such as maybe pregnancy complications, illness, job loss, miscarriage, any health issues, or your baby has like special needs, you have triplets or twins, or just multiple births. Not only these factors associated with yourself, but also if you have a weak support system, that can also lead to depression. Now the question is, can postpartum depression or PPD be prevented? Yes, definitely. Postpartum depression can be prevented. Counseling with a small group or therapist can actually prevent PPD. See, when you talk about your feelings and concerns, the counselor or therapist can help you understand your feelings, solve problems, and cope with the things in your everyday life, which if you try to fix on your own, sometimes you just get in a loop and are not able to fix them. So do talk to therapist or counselor or a group so you're able to unwind those feelings of confusion or depression. And if you have a history of postpartum depression, your doctor may actually recommend antidepressant therapies or psychotherapy immediately after delivery so that you don't go in the deep hole of postpartum depression. The most common treatment for postpartum depression is therapy, support from your partner, family, and loved ones. So literally, the first step in treatment is recognition of the problem and sharing about it. Don't keep it to yourself, because it's not just for yourself, it's actually for the sake and health of your baby. And if therapy alone is not helping, then medications can be used. Antidepressants are most commonly prescribed for this condition as they will help relieve the symptoms of depression. And some of these antidepressants can also be taken while you're breastfeeding, so you don't have to worry about their effects or side effects going into your child. Just keep in mind that antidepressants do take about 5 to 6 weeks to start working. Sometimes they may cause restless leg at night time or excessive sweating. They may impact your libido as well. So if any of these side effects occur, definitely let your doctor or pharmacist know so necessary dosage adjustments can be made, or the antidepressant can be just changed to another class of the medication which does not give you these side effects. In addition to medication and therapy, there are things you can do at home to make yourself feel better, like rest as much as you can, sleep when your baby is sleeping, make time to go outside, do some yoga, exercise, or maybe just go get some fresh air or do whatever makes you happy. Just don't try to do too much or do everything on your own. Ask for help if you need. Lean on your partner and loved ones. Tell them how you are feeling, because people around you who love you and care for you would not know what you need or how you're feeling unless you tell them. Just remember, whatever treatment route you take, it's very important to follow through and not leave the condition untreated, because untreated postpartum depression can affect your ability to be a good parent. You may not have enough energy, you may have trouble focusing on the baby's need and your own needs. At times you may feel moody, and you know what? You have a higher risk of attempting suicide. So if you think you have postpartum depression, just remember, you and your baby don't have to suffer. There is help. Getting treatment is important. Taking medications for depression or going out to therapy does not make you a bad mother or does not make you a failure. In fact, think of it in a way that getting help is a sign of strength. You're fighting to get over it, so you're strong. Alright, so that's it for today's video. I hope you found value in this video, and we'll share it to spread awareness and save lives. Thank you so much for watching, and I'll see you in next video. Don't forget to subscribe so you don't miss any informative video on health and pharmacy on my channel. Take care. Bye.